Okay, good morning, everyone. I see the use of descriptions, relative clauses, and quantifiers as we use the language. Now, what we've been doing over the last couple of days is practicing using the articles, and you also saw a little bit of the noun phrases. Now, I'm going to go a little bit deeper now. You'll see complete noun phrases, more of what you saw last time, but you'll also see two new things, and that's the relative pronouns and relative clauses. You'll see what we call defining clauses, and you will see what we call non-defining clauses. Now, on your screen, you see what I've been working on, but before I dive into that, I'd like to start with a game. All right. So in this little game, I'm going to put some sentences in the chat, and I want you guys to think about what we do in this field. All right. In dentistry, there are lots of different things that you can do. But specifically, I want you guys to think about either the people or the things. All right. Now, I'm going to put them all together as one long list. And of course, if you think you know the answer, you go ahead and raise your hands, or I'll pick on some of you. So there are 6 different things, and I want you to try to guess what they are. All right, so let me put it in the chat, and I want you to guess. All right, I think everyone, well, there's a few more people. Also, don't forget full names and groups in the chat. All right, let the games begin. If you think you know, go ahead and put up your hands. And let me see. I'm going to start with, let me see, who was the very first person who came in? I'm going to start with Rachel. Where's Rachel? There she is, Nicole. All right.
Yes.
All right. The first option, Nicole, is I am a tool which is used for removing plaque and calculus from the tooth surface. If you don't know the name in English, that's okay. You can tell me in Spanish. But what is that?
Oh, it's una cureta.
Exactly. The curette or the scaler. Excellent. Good job. All right. Number 2. Let's see. I am the person who assists the dentist during procedures and manages the instrument. As I mentioned, guys, if you think you know the answer, you can raise your hand. And this one, let's see. Let me look at my list of people. Dun, 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 dun. All right, let's go with Ana Laura. Who's that?
Yes.
Who's that person? All right, I'll read the clue to you again. I am the
Um,
person who assists the
uh,
dentist during procedures and
Present.
manages the instruments.
It's a dental assistant.
Exactly. Good. Awesome. All right, number 3. I am the area where the lower wisdom tooth is most commonly impacted. All right, and for this one, let's see, let's see. Let's go with dun dun dun. Well, let's go with Luna.
Yes, teacher.
All right. What area is that? If you don't know how to say it in English, don't worry. Tell me in Spanish and I'll help you. The area where the lower wisdom tooth is most commonly impacted. What do we call that?
Mm, No sabría decirle que
All right, anybody wants to help her?
mm, ¿no podría repetirlo, por favor?
Yeah, of course. I am the area where the lower wisdom tooth is most commonly impacted.
No, no me doy una idea.
You don't know? All right. Anybody knows? Anybody wants
Mm,
to try? Let me look at the list. Dun, 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 dun. Let's see. All right. Lots of people coming in. Catherine, Luna. What's that area called? Right? If you see wisdom teeth, you know it's going to be where your molars are. All right. So that's going to be obviously at the bottom. If it says lower, and if it talks about wisdom, you're talking about the left or right lower quadrants. All right. That's where your third molars are. All right. Let me go down in the list. Fatima. Let's see. Let's go with the document whose contents describe the patient's full medical or dental history. What do we call that, Fatima?
Mm, yo creo que dijo que cuál es mi instrumental favorito de odontología.
Now, listen again. The document whose contents describe the patient's full medical and dental history. What do we call that?
Brasil.
Okay. It's a document, guys. What do we call that document? Anyone can take a guess? Catherine, Luna. Let's see who else are at the top of the list there.
¿Es la historia clínica?
Good. So the clinical history, their expedient, their medical file, or their medical chart. All right, let me go with another person. Carla Ruby. Let's go with sentence 5. I am the phase when the dentist removes the sutures after the healing period. What do we call that? Is it the pre-operational? Is it the operational or the post-operational phrase?
Para decir postoperatorio, después de.
Exactly. Post-operational phrase. Good. All right, and last one. Let's see who is gonna be a wonderful dentist someday. Let me go all the way down to the end. Natalia. This one is yours, Natalia. The condition that causes irreversible damage to the pulp of the tooth.
¿Es Natalie o Natalia?
Natalia, but if you think you can do it, Natalie, go ahead. What do you think?
Ah, es pulpitis, ¿no? Creo.
Exactly. Pulpitis. Good. All right. Now, what did you notice about my sentences, guys? All of these sentences have something in common. They're all long sentences with noun phrases that have our pronouns, who or which or that or where or when or why or things like that. And they're all doing the defining job. These are what we're going to be practicing today, guys. The relative clauses and our pronouns. But let's first, these are the examples I was showing you in the sentences. All right. So first of all, let me get some of you to read so we can practice a bit. And for those just joining, keep going. Good job, guys. Full names and groups in the chat. All right. Jennifer, read for us. I am.
Yes, I am a tool which is used for removing plaque and calculus from the tooth surface. The scalar correct.
Excellent. All right. Luna.
Okay. I am the area where the lower wisdom tooth is most commonly impacted. The lower left right quadrant.
Good. All right. I hope you're noticing we're using our pronouns, which and where. All right. Next one is for Kathy. Are you there, Catherine?
Sí, es I am here lives when the dentist removes the sutures after the healing period, the post-operative appointment.
Good. All right. Let's keep going. Let's go with Luis. I saw your folder, Luis. Good job.
Yeah, I am the person who assists the dentist during procedures and manage the instruments. The dental assistant.
Good. And Luis Antonio.
Yes. Which one?
Next one with whose.
Ah, I am the document whose contents describe the patient's full medical and dental history. The patient file chart.
Good. Now, one last one with Paula Esquivel.
Yes, I am the condition that causes irreversible damage to the pulp of the tooth, pulp necrosis, pulpitis.
Good. Now, all of these are things that we know. And these are different ways of describing the situations. Notice we have our different relative pronouns, and these are relative clauses. Now, in these sentences, I'm using relative clauses, but they're all in what we call defining form. Now, each of these relative pronouns does a specific job. So let's zone in on these specific jobs. Let me switch my screen. Let me move some of these boxes around. And let's go over to our relative pronouns. Now, when we think of relative pronouns, guys, we're thinking of that, which, who, whom, whose. But we're also thinking of things like where, or when, or why, more adverbial phrases. And what are they doing? They're adding information that will modify our noun phrase. These specific ones are pronouns because they are going to work inside our sentence to help with information about the noun. Now we know the noun can be a place, can be a thing, and it can also be a person. That, for example, the condition that causes pulpitis is very flexible. We can use it when we're talking about people and things. We also had which. We're talking about the instruments. Which instrument? The scalar or the curret. This is only used for things. Then we also saw who, or sometimes we'll see whom. Now, who and whom, they're used for people. Who is the one you'll see more? Whom is more for object pronouns, and it's definitely something you use when you write. But most of the time when we speak, we only use who, and we replace whom with who when we're speaking as well. We also had whose, as in which document contains or possesses this information. The patient's file, their medical history file. This is a possessive pronoun. All right, so it indicates both for people and for things what belongs to that person or that thing. Now, we also noticed where and when. We didn't have why, but all of these are referring to either time, when, the post-operative appointment, location, where, the lower quadrant where you have your wisdom tooth, and reasons, the why. For example, I bought the ticket because I was told I need to have documentation, and that's why I need to have an entry and exit ticket, right? These are all words that we will see when we are going into our relative, and in the relative clauses, we have the defining and the non-defining. All right, let's go back. And if you joined late, don't forget full names and groups in the chat. Let me make sure. Good. Let's go through some more. So, with who, we're going to see people. Harumi, let's look at the examples for who. Can you read for us?
The patient who has periodontitis needs surgery.
Surgery, correct. Continue.
The specialist who treats her is at Hospital Angele.
Good job.
Dr. Perez, who trained in Spain in our endodontist.
Tist. Good. Now, with who, we can replace who with that in these defining clause sentences. All right. Zanya, hopefully your internet is working. Let's go to which. We use which for things or people or their anatomy. More so for things because we can identify the option. All right, can you read the examples for us, Zanya?
Yep. The molar which is impacted requires extraction.
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 Mhm.
The filling which was placed in 2018
18.
has fractured.
Mhm.
The X-ray which we took last month shows improvement.
Good. All of these examples, these first six are what we call defining clauses. And who and which can be replaced with that. So I can use here that and that. Here I can use that and that. In this sentence and this sentence, we have what we call non-defining clauses. These non-defining clauses are extra. We cannot change the which or the who here. It has to stay the same because we need to specify because it's extra information. All right, let's go to whose or possession. Jesus, Adan.
The patient whose crown fell on calling this morning.
Okay.
A patient was feeling weak.
The
Can
patient whose
he was
file
admitted? file.
We cannot find.
What
Was
we can find has admitted.
was admitted. All right. Dr.
That's
Lee,
what Dr. Lee, whose
whose
clinic is in 1% are referral.
referral. All right. Let's go with where. Aline.
Yes, teacher. The quadrant where the extraction occurred is healing. And
Healing.
healing,
Healing. If you see two vowels together, the first vowel will be the stronger one. Healing.
healing. Okay. The operatory where we do implants is room 3.
Good.
The area where the bone loss occurred is the lower left.
Good. And Mariana, when? Herrera Ruiz.
Yes, teacher. When the best when we remove structures
Statues.
in structures is after 7 days.
All right. And you know the sutures are those that we have inside. Usually we close them off. All right. Continue. The appointment.
The apartment when the crew has fitted
Crown.
when ground has fitted when well.
All right. So appointment, maybe it was on Monday, maybe it was on Tuesday, and the operation was fitted and everything was good. All right. Number 3.
There are moments when paint indicates nerve damage.
Nerve damage.
Nerve damage.
Good. So these are some of the relative pronouns you will see, and these are some examples of either defining or non-defining clauses. Now, depending on the situation, you need to choose. Is this information 100% necessary? If the sentence empty without it? If that's the case, we're going to be choosing a defining clause. You notice there are no commas, and the clause will help us to identify the who or the which thing or person you are talking about. All right? Angie, Araceli.
Teacher,
All right, let's continue reading. The incisor
the incisor which in shipped needs a veneer.
All right, the patient.
The patient who has diabetes requires different anesthesia.
And the tooth.
The tooth that fractured during extraction was a lower molar.
Good. Now, if the sentence is complete and you want to give extra information, you'll put it in commas and you will add information. But be very specific. Do not use that. Tell me if it's an option, a person, a thing, a place, a time, or a reason. Be specific because you're giving extra information. All right? Notice here, if I say the incisor which is chipped needs a veneer, that means I have multiple incisors. All right? If I say the incisors which are chipped, I'm talking about all the incisors have chips. So all the incisors need veneers. All right? Karina, Dr. Torres.
Yes, Dr. Torres, who trained in the use, performed the surgery.
Surgery. All right? And the amalgam film.
Uh, the amalgam film, which was placed in 155.
All right, be
No,
careful. You see 2 and you have 1, 2, 3 places. 2015 or 2015.
2015 house fracture.
Fractured. Good. So Dr. Torres performed the surgery. Oh, Dr. Torres was trained in the US. The amalgam filling has fractured. When did it get placed? It was placed in 2015. These are examples of extra information. All right? Now be super careful. If you know the situation requires the information to decide if it's a person or a thing or clarify, then it's going to be a defining clause. No commas. Make sure you connect your sentences. Now, some of our sentences, and I'll switch back my screen, some of our sentences will have two phrases, and one of those phrases will have a noun and verb combination, and another one will have a relatively straightforward connection. Be careful. If you notice, I'm going to switch my screen again. If you notice that the clause includes two phrases with a person and the verb together, then you're not going to use the pronouns. You're going to avoid pronouns. Why? Because those sentences already have a clear connection. You don't need to show the connection because there's a person in that sentence or a thing in that sentence that's clearly identifying the connection. And I'm going to show you some examples. Now, think of those ideas, whether it's defined or not defining. We would use which or than, or we would use that, or would go a little bit deeper with the person. Now look at these examples. Some sentences will have a person plus the verb. That's one time where we can omit the use of our connectors. We also leave it out if you can clearly identify I plus your verbs. Let me show you another example. All right. Here I have who or that, but if I have I and the I directly connects the idea, then I won't need the that. I could simply say the girl that I introduced you to is at the party. You don't need the that. The that helps, but it's not always necessary. Now, look at these combinations again. If you can separate your sentences into two sentences, that's what I mean by a non-defining. All right? If this is just extra information in the bracket, it could be a sentence by itself. That's a non-defining sentence. It's defining if the sentence does not make a lot of sense without that information. All right? And here, for example, we have a patient. If I take out the who has and I replace it with I, that can also work. So try to figure out if your sentence needs defining. If it's you doing the action, sometimes you don't need the who or the that. You can say, the patient I introduced, or I medicated, or I gave anesthesia, blah, 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 blah. Why am I saying this to you? Remember, goal of this particular unit is a forum activity, guys. So practice as much as possible with using your defining clauses and your non-defining clauses in different situations. Now, let's get some more volunteers in. Let me move this box out of the way, and let's do some more reading. Let's see who has not participated. Anna Karen. All right, let's practice, Anna.
Loleo,
Yes, please.
I am referring a penis who has a severely impacted lower third molar.
All right. Pause, Anna. Lorena.
The tooth, which has been causing pain for 3 weeks,
Mhm.
is partially erupted.
Right. Ivanovich.
Yes, the patient whose medical history includes hypertension requires special care.
Right. Let's go with Miranda.
Yes, teacher.
The area.
The area where the infection occurs is very close to the inferior alveolar nerve.
Good. Uh, Gesarelli, Estrella.
The pain which started when she bit down on hard food is worsening.
Good. And we can also do these in question form. Now, these questions could obviously be answered by these responses, but let's practice them all the same. Paula, Karen, Moreno, Morales. Can you describe?
Can you describe the person who was referred? Who is she?
Good. Natalie.
Yes.
Mm-hmm.
Uh,
All right, remember to unmute. Or did we lose Natalie? Which tooth? I think we might have lost Natalie there. Which tooth exactly is affected? Is it the wisdom tooth that is erupting? And Natalia, let's go to the next one.
The patient whose history you mentioned is the hypertension controlled.
All right. Nicole,
Yes,
can you
which,
identify?
oh yes, can you identify the area when the nerve is risk more precisely?
Precisely. And let's double back to Ana Laura, last one.
Yes. Which one? Sorry.
The last
The
one
pain.
you mentioned.
Uh, you mentioned the phase when the pain started. Was there trauma involved?
Good. All right, so we can have questions using our relative clauses and responses using the relative clauses. Here I have more general situations. Some of these are more surgical situations, but these will help when you're dealing with patients. All right. Now, if you haven't done so, make sure you wrap up working on your evidence folders. Let me know when you're finished and send me an email update and I'll double check. Some of you have already done so, so good job. And jump onto your portal and complete your forum. Some of you may have missed other forums. Go back and double check. Go back to Unit 5 as well, right? The deadline to make sure everything is up to scratch is the 30th of April, sorry. All right, so double check what you have outstanding, make sure that you understand everything nice and clearly. And of course, if you have issues, guys, if you have questions, let me know. If you see something that doesn't make sense, jump in and check it out. We'll connect next Saturday where we'll start our last unit. All right, so get busy. After that last unit, we're going to have unit review and a full test of the new block for 6. All right, so as much work as you can do, pace yourself and get everything done. If you don't know what's missing, ask. I can help you search. All right. See you next week. And I look forward to your emails and your submissions. Bye bye for now.